Welcome to the first event in the 2022 Healthy Working Live Seminar Series. Today is about health impacts of regulations in the industry and in the transport industry. So I'm Dr. Elizabeth Pritchard from the Driving Health Research Team at Monash University, and I'll be your MC for today's event. It's fantastic to have you here, whether you're joining us live or whether you're watching the replay. Welcome. We acknowledge the sacred land of the Wurundjeri people on which we are based and pay our respects to the thousands of years of wisdom and knowledge found with the Indigenous owners of the land. Wominjeka, welcome, kia ora. In today's seminar, we have three guests and I'd like to introduce them. First is the lead researcher of the Driving Health Project from Monash University, Associate Professor Ross Iles. Also joining us today for the panel discussion is Greg Phil, who is a Director of Safety at the National Heavy Vehicle Regulator. And we also have Rod Hannifey, who is an OzHelp ambassador and also a truck driver with daily experiences of being on the road. So for today's session, Ross will begin with a short presentation about the driving health findings relating to health impacts of regulations in the transport industry. And this will be followed by a panel discussion with Greg and Rod. There will also be short Q&A at the end of the session. However, throughout the seminar, you can submit questions via the Ask a Question box, which is located below your live stream box on your screen. So we'll be answering some of those throughout the seminar and some will be for the Q&A at the end as well. So scroll down and you'll find the button and feel free to ask questions anytime. Right, let me hand over to Associate Professor Ross Iles. Thank you, Ross. We'll be back in a minute.
Thanks very much, Elizabeth. Welcome everyone to the first of the Driving Health Seminar Series, Health Impacts of Regulations in the Transport Industry. Elizabeth has mentioned a little bit of this so far, but basically the way we're going to run these seminars is we're going to welcome everybody, make sure everyone's on board, got time to log in. I'm going to cover some of the research findings that we've found through Driving Health. And if you want to know more about the Driving Health project, on the Delegate Connect platform, we have some videos that introduce certain aspects of the project and what we've done, some of the research methods that we've used. And the idea is that we want to talk about what we found during the seminars, but you can always catch up with some of the in-depth information otherwise if you want to dive into it. We're going to follow with a discussion and across the seminars, there'll be different people that will bring different expertise to the table to cover off the issues and actually make sure that we connect what we found with the research with what's actually happening on the ground. And there's also that opportunity for you to ask questions. And we really encourage you to ask questions so we can make sure that we tailor the information that we've got to your experiences out there. So there are 6 events in the seminar series. As I mentioned, there'll be an overview of the research findings. We'll have some industry experts. And what's really important to note is that we really want to get this information out there to everyone. So everything is going to be recorded. It's available freely online at drivinghealth.net, as are all of our research reports. So there's nothing hidden. Everything's freely available and online if you go to drivinghealth.net. And also there'll be links there to the Delegate Connect platform as well. And if you're unable to join today or you know someone who might have been interested but they were unable to join the live stream, they'll actually be able to catch up and watch videos on the platform, particularly to catch up on the discussion topics that will really flesh out the points made by our speakers. But first, I guess the most important thing to do is to give everyone some background about how we've approached what is really a complex problem in the transport industry. We have divided the information that we've collected into different categories or domains. And so this first domain here, the personal domain, is where we've collected or grouped information about drivers themselves. Gender, age, education, things like financial stress, the number of children, those sorts of things fit in the personal domain. Things about how the job gets done So the experience drivers bring, the type of payment they receive, the hours they work, whether they're a long haul or a short haul driver, all of those factors fall under what we've labelled as the occupational domain. And there's a little bit of overlap between these domains, and we've tried to represent that here with the circles overlap. We have the workplace environment domain, and we know the actual workplace environment is very specific for truck drivers. Not only does it involve the truck that they're driving, but it also involves delivery centres where they load and unload. And so we think it's really important to acknowledge that workplace environment, particularly for truck drivers. We've also examined things related to lifestyle. So what people eat, how much physical activity they get, whether they drink or whether they smoke, and that fits in the lifestyle domain. But then we also know there are some certain things about people or things that they do that can impact their risk of developing certain health conditions. So their weight, represented as BMI, body mass index, whether they're fatigued, how well they can sleep, perhaps the medications they take. Those things we've characterised in the health risk domain. And in driving health, we have focused on the health outcomes of psychological distress and general health as reported by truck drivers. But we've also collected data on driving outcomes, being near misses, and drivers' self-rated ability to do their job. Now, our seminars are actually grouped around most of these domains. And today's domain that we're focusing on is that big red rectangle, which is the regulatory domain. And the information that we've captured related to that, we've captured information about occupational health and safety training, but also the drivers, we asked them how often have they had to break regulations. So I'll talk you through the findings of the Driving Health Project, and we're going to focus on the regulatory domain. So there's many more findings to cover, but we've tried to keep things short and sharp and focused on what we're talking about in terms of regulations. So in the Driving Health Telephone Survey, we actually we asked drivers to indicate whether they'd had a certain type of training from 9 different types of occupational health and safety training. And what you can see on the screen now is the results of that that survey, of that telephone survey. And you can see there that site inductions, the bar in blue are those drivers that actually said yes, that they've actually had that level of training. And that's not surprising that 90% of drivers, 90% plus, actually said that yes, they'd had that type of occupational health and safety training. The orange bars down on the left-hand side are those who said, no, I haven't had that level of training. And so we can see as we go from site inductions, general OH regulations and practices, as we work down the type of training, we see that the number of drivers confirming that they'd had that type of training actually tails off, right down to the point where we get to defensive driving or advanced driving skills is sitting at just under 40% of drivers said that they'd been trained in that, and then stress management, where we've got a little over 20% of drivers saying that they hadn't, that they had training in how to manage their stress levels. And when we see the last bar, none of the above, that very, very few drivers said that they hadn't had any of that kind of training. And so what we were able to do when we looked at this, we were able to think about all the different domains together and take into account all those things from the personal domain, the occupational domain, lifestyle and risk factors. And what actually came out was that drivers who had high levels of OHS training, so they had reported being trained in more of those factors, were more likely to say they had a higher workability, that is, that they were able to do their job, and they actually had lower levels of psychological distress. They were less likely to be distressed from a psychological point of view. So what that tells us is that occupational health and safety training is a good thing, and it's actually helpful for drivers to actually receive that training, all the way from site inductions all the way down to how to deal with stress. Another aspect of the driving health study is we had interviews with drivers and their family members, and you can check out the video on the platform to tell you how we actually go through the analysis of those interviews. What we were able to do is put together a summary, and drivers mentioned 7 key factors that needed to be balanced in order for them to be happy and healthy, if you like, or to improve their well-being. And they're represented on this wheel here. And those 7 factors cover the environment, attitudes, physical health, mental health, relationships, and their working conditions. And then regulations also features there. And no doubt there are drivers that are more heavily impacted by regulations than others, but all these things need to be in balance for driver well-being to be strong. If you think about it, even if your physical health is a 10 out of 10 and your mental health is 10 out of 10, but if regulations make it really difficult to do your job or to do it well, then you're effectively driving with a flat tire. So drivers told us they need a balance across all of these factors. Even if regulations are 10 out of 10, if that means attitudes or relationships aren't going well, then your driver's health and well-being is going to suffer. When we asked about braking regulations, we asked drivers how often they had to do some of these things. So how often did they, for example, drive having taken fewer or shorter rest breaks than required, or how often did they drive in excess of the speed limit? And on this diagram here, the dark blue part of the diagram is daily or almost daily. The light blue is weekly, and the lightest blue is monthly. So the blue part of the graph is telling you what proportion of drivers, at least monthly, ended up breaking some of those regulations or some, these regulations that we have here. And when we summarise that all together, of the drivers that answered this question, 63% reported breaking regulations. Now, we bring this up not because it is about trying to name and shame or identify people doing the wrong thing. It's actually about identifying when a driver's put in a position where they have to make a choice between actually doing their role and doing it effectively and actually following the regulations. And I think it's important to put this in the driver's own words here. I'll let you read what's on the screen because you'll read it faster than I will say it out. But what it's actually about is that there is a real pressure to comply, but against penalties that if you don't comply. And the threat of fines when you're simply trying to do a job, it's been described as sitting there on your shoulders, and you can get a fine for a simple mistake, and that can weigh far heavier on you if you make that mistake. You have to pay the fine. Yes, there's a review process. Sometimes that review process isn't straightforward. And at some stage, it gets to the point of, well, where do you get the food to put on your family's table, for example? Because perhaps there was a box that wasn't ticked, or you wanted a better meal to eat, or you're at a rest area, or you needed a shower. And there's real challenges for drivers, and it's described here as that inner turmoil that festers when you actually have to make a choice between having a better meal or having a shower or getting better sleep. And it can be really challenging for drivers when a lot of the reasons when they have to make that decision could be outside of their control. If there's been a delay on the road or delay loading, that means there are fewer hours left to drive. And that means that they use up their hours before there's a suitable place to stop the truck, where there's no truck parking, or where they do stop, the facilities they know are substandard. Then the decision has to be made. Do I follow the rules and risk a fine by parking where I know I shouldn't park? Or do I keep driving to actually get to a park where, and I'm risking a fine if I actually, that I might be maybe only 10 or 15 minutes over your driving times. And we know that actually increases the stress and pressure that's placed on drivers. And so that this regulation behaviour and the conversation that we're hoping to have today is about how can we actually, not put drivers in those situations where they need to make those very difficult choices daily, and drivers told us at least monthly. So that's pretty common in my book. But I have never driven a truck. I'm a researcher. I'm not a truck driver. I don't work in the transport industry. So what we're aiming to do today is to have a discussion with people who can bring that perspective. And that's where Greg comes in from the NHVR. So Greg's got a long background in developing safety-related policy systems, regulatory frameworks and legislation related to different transport modes in Australia. His responsibilities at the NHVR include influencing industry safety improvements. That's via the national reform agenda, and particularly through the current the Heavy Vehicle National Law Review. And so Greg is a fantastic person to give us a perspective on regulations and how we can and how we can actually understand their role that they play in driver health and wellbeing. And the second person we'll be inviting to the discussion today is Rod Hannifey, who is a truck driver and OzHelp ambassador. He's a full-time driver and he's the pilot and instigator of the truck right industry vehicle and has travelled nearly 6 million kilometres. It's a lot. Writes a monthly column, Eye on the Road, for Owner Driver magazine. And I'm sure you'll see that he's very passionate about improving both road safety and how the road transport industry is seen by the public. Now, through the magic of the platform, we are going to kick off a discussion in just a moment. So we'll be back in just a second. Thanks for joining us, everyone. Hi, Greg. Hi, Rod. How are you both?
Good, thanks, mate.
Yeah, g'day. Hi, Ross. Great to be here.
Thanks very much. My first question is for you, Greg. I'm a researcher in the work and the health and safety space, if you like, and it's really encouraging to see that having a higher level of OH&S training was actually, associated with better psychological health and better ability to do the job. I guess, from your perspective, why do you think that might be the case?
I think you've already covered off in some key aspects, Ross, that certainly from an employer's perspective, if there's that level of perceived care and attention by an employer, they think and they understand that there's a systemic approach to their safety and that there's not just verbal assurances. I think that plays more towards, an employee thinking that others care about them. And when that happens, they feel confident that the company's not putting them in danger. It's open to also raising safety concerns with the operator if it needs to, which is a great thing. And that they'll action them. That really builds towards that, that positive work mindset. In classic improves safety culture. I think also, and you're the expert on this more than myself, but from what I've seen, a training also opens a trainee's logic pathways to realising the safety benefits of the education provided. It's not just, I think that's more so than someone who's just has some sort of encouragement, to act safer. And I think these days that perception of a driver being a professional driver in a safe environment then helps, them best concentrate on the task at hand.
Great, thanks. Rod, thanks for joining us. I can see you're on the road today. We were discussing the other day how sometimes the best intentions from an OHS perspective can have a negative impact in terms of delays. Could you tell us a little bit about that?
Well, mate, the laws are written and policed by people who do not have to live by them. So I don't go to work to break the law. I don't know any driver that does. But the thing is that if you have a job where you do the same thing every day, then you know that you can be compliant simply. You know that you have some control over what goes on. You go to work at the same time, you do your job, and that's easy. The trouble with many of us is that you don't know where you're going to be tomorrow, and you don't know what's going to happen now, let alone on the road. Might be an accident, might be a delay, might be roads closed. Then all of the other people that affect what I do, whether it's the customer that says you must be here at 3 o'clock and you get there at 2:45 and you say, yep, right, mate, ready to go. Oh, we're a bit busy. The Forky's kicked his toe, or, I'm doing something else. Just wait over there for 15 minutes. So you wait 15 minutes and then you think, well, I won't push. I'll wait a bit longer. And then you go, what's going on, mate? Yeah, look, won't be long, mate, won't be long. Yeah, we'll be with you soon. And an hour later, you get into that point where you're ready to throttle someone and you say, what the hell's going on, mate? I came here on time. What's going on? Oh, well, why didn't you tell me that you had a drama? I could have gone to bed. I could have had a kip. But then, of course, you might not be able to do that because the yard's noisy and it's dusty and it's dirty. And then, of course, When you finally get loaded at 6 o'clock, the bloke says, oh, well, you'll still be there at 8 in the morning, won't you? Well, no, you should have recognised that when you held me up for 3 hours loading. Oh, well, there's nothing. Well, yes, there is. And the problem from where I sit, the chain of responsibility is a marvellous concept. But I'm the poor bugger swinging at the end of the chain. Everybody else is up the top telling me what to do, whether it's the customer, the boss, the regulator, the copper on the side of the road, the car driver who's holding me up because he thinks he's a bit of a clown. All of those people affect what I do, but none of them are responsible. And I can't blame any of them. I still have to meet all the laws and the requirements. And then you've got to find a rest area. You've got to find a toilet. You've got to find somewhere that, luckily I'm parked against this tree here, but it's probably the only one for about 200 kilometres either way I can get anywhere near. And then I still bear all the responsibility. I must comply with all these laws. And it's not that you want to break the law. It's simply that I don't feel tired, or I don't want to eat here, or, geez, there's a better shower there half an hour up the road. But to do that, I have to break the law. And then, of course, the penalties, particularly where it's something in our logbook, and I don't know whether you've ever looked inside a logbook, mate.
No, never.
Boxes, right, that you've got to tick. And in the past, if you didn't tick them, you could get a $600 fine. Now, we eventually complain that what is a clerical error has nothing whatsoever to do with road safety, and that is now a $185 fine. But please show me another job where if you forget to write a tick or put a date on a page where the numbers are consecutive, I can't hide the page, I can't hide a day, and yet someone will pull me up and say, oh, look, geez, you didn't put the date in. Here's a $200 fine for that. You're a dangerous drug-crazed truck driver. And it puts a lot of weight on you, and all you want to do is to be able to drive when you're fit and sleep when you're tired. There are so many factors that affect that, but if you don't do it their way, the people that make the rules, then here's a fine, and you should enjoy that and be thankful that we kept you safe. And what they do then, they actually force you to either drive when you're tired because of the camera that you've got to meet, or the deadline, again, the customer, or they expect you when you're wide awake to pull up and go to sleep for 7 hours because they say you can, but it might be 50 degrees in the middle of nowhere with not a toilet for Ks. And those things, with the best of intent, make it harder for me to comply and to remain safe on the road.
So it sounds to me, Rod, that there's quite a few unintended consequences of some of the those rules and regulations in place. And those rules and regulations are, like you said, they're all best intentioned. Greg, how do you think, what's the best way to try and to see if we can avoid those unintended consequences when rules are brought in?
Yeah, look, and I'm not saying it's an easy one, and I certainly know where Rod's coming from, and we have a lot of other operators in the same boat, and drivers. I suppose the laws are there in place. We'd like certainly more flexibility and changes to be put in place. Ourselves as a regulator is certainly on record for doing that, but they don't offer that level of flexibility at the moment to in the everyday set of hours of work and rest. Those rules that Rod's referring to. I suppose ourselves, there's roles that the broader industry can take from a regulator. Some of the things that Ron talked about, we're trying to do better around a more risk-based approach rather than just randomly pulling over people. And, again, we don't want to spend time and money and effort pulling over people that are compliant with the laws. You want to target people that are willfully or negligently going against those. Rod also talked about, the regulator and the rules and the broader industry trying to target those who put undue pressure on drivers. Now, whether that's through operators, etc., and it pushes it more in that productivity side rather than the safety side. So, for example, if you have someone in the chain of responsibility that's trying to negotiate with an operator to say, I need you to go from A to B, and if you don't do it in this period, you won't get a contract. And so the law is quite clear on that and what it should do, but trying to pin those down and to go that prove that that's the case. Operators and drivers are under pressure to accept contracts. There are small margins in this industry, and it's long hours. And unlike other transport modes, certainly that I've worked in and across and regulated in and across, we have lots and lots of operators in this business, where we have 400 or 500 rail operators in Australia, a lot of them small ones. We have more than 40,000 in Australia. So it's a very large and diverse industry, and also having a set of rules, one set of rules that applies to all of them, that's scalable, is a tricky component. What I will say, Ross, is that as well as the laws, they do say what you can do and what you can't do. The laws don't say how you should do it. So it is up to the operators and those other parties in the chain to try and work around that. Now, and to Rod's point, I'm not saying that's easy. I'm not saying it's perfect. It is imperfect, and that's why some of the laws need to change. But it does need to be a whole of industry perspective, from the regulator through the operators to those other third parties, and about everyone working together on that. Infrastructure, Rod talked about having sufficient rest stops, not just the rest stops that are good quality, but enough of them so you can pull over. Australia, pretty big brown land. There are nowhere near enough rest stops and the sort of infrastructure we need to support that component. A tricky one, but it's looking at it holistically. It's certainly not just from you change the law, then that will be perfect. That certainly won't happen.
Do you have any comment on that, Rod? I think you're on mute, Rod.
Yes, I am. Thank you. I recognise the role of the NHVR, and we've looked forward to having one set of rules in Australia instead of 7. The trouble is we still don't. We sort of have 2 sets. I know that the NHVR is hamstrung because the NTC are the people that make the rules, and I've tried to deal with them as well. And then, of course, even when they do make the rules, then the states turn around and say, well, we like this one, but we don't like that one, and we're going to change it. And it used to be it was hard enough to survive in one state, but now you've got to survive. Okay, we're back to 2 lots of rules, but even then, New South Wales still changed different rules. And for someone that works in a state or in a town, they can reasonably easily and simply keep up with changes. But you imagine trying to deal with things where they keep changing the guideposts. Now, COVID was a perfect example of how to screw us over. We had a national freight protocol, and that was that truck stops would remain open. And yet individual police walked into truck stops and said, if you feed a truck driver, we're going to give you a $10,000 fine. And everyone wants us to deliver the goods. They all want it yesterday for nothing. But how the hell are you going to remain safe, fit, be able to eat, use a toilet, get a shower when they go and close all the truck stops? And the industry's never really been recognised for what it does. All of a sudden, when people ran out of toilet paper, we were very important. And they talk about it, we recognise what the industry's done. But honestly, I don't think people do. If you ask people, where does milk come from? Falls out of the sky by magic every morning. Just happens automatically. But you realise what's involved behind that. And that's where our industry has failed in making people aware of what we contribute to their way of life. And because of that, it is very hard to get heard at levels of government. The last thing I'd say is we currently have the HVNL underway, the Heavy Vehicle National Law Review. I said to the NTC, you must make this simple. You must encourage drivers to give you something, even if it's what's your one biggest problem. Oh, well, it's the logbook fines and this is why it's a problem. Really good. What did they do? They put out 7 documents, the first of which had 70 pages of reading material to read before you even answer the question. Now, no bloke has time to do that. And the drivers I talk to are very cynical. We've told you we need more bloody rest areas. We want the roads fixed. We want motorists taught how to share the road with trucks so they don't kill us. And we haven't touched one of those things in 20 years They finally come up with a review and they make it so convoluted and difficult and time consuming. And blokes say, honestly, these bastards aren't going to listen. They're not doing it for us. They're doing it to say that they've consulted, but will they listen? And so the average driver says, I can't win. Why should I bother? And honestly, there is so much of that out there. They have every right to be cynical for those reasons.
It sounds like a real challenge, Greg, but like you said, there's 40,000 plus operators that you need to engage with. And it sounds like what Rod describes sounds like something an academic would do, send an 80-page document. I'm an academic, never use 5 words when 50 would do. What are some of the challenges, I guess, with, trying to, capture the views of such a widely dispersed group and actually engage them in a way that, can be effective?
Yeah, look, it's, and I can prattle on for ages about it's tough and it's hard and all that sort of stuff. I suppose, and I'm not going to disparage other colleagues and other agencies about what they should be doing. I suppose I can only point to ourselves, and this is the NHVR, I think, prides itself. Its model, we've just released several months ago, a new safety strategy predicated on how we partner and communicate with other parties. So we have lots of vigorous discussions with many of our a lot of our stakeholder groups. But that's the way that you really engage on something and get to understand the views of different parties, Rod and others alike. But you've got to do that, and you've got to do it proactively. You just can't wait until you've got something to say, and to do that. And I suppose I think there's also this recognition, if we go back to the subject we're talking about today, and it's regulations are an important component, and better regulations going forward are going to be vital in improving, driver health solutions. Make no bones about that. But it would be folly again to say, well, if we just had better regulations, then we could just rely on that, because that won't be the solution. It's got to be, as Rod said, it's multifaceted, and as well, it's not just licensing; it's the whole driver experience, their level of competency, the driving laws, the systemic approaches that employ. For employees by operators. So that's building that culture. Operators and the industry does need to take that responsibility on as well. But also, we don't want those adverse pressures from third parties. The whole productivity versus safety aspect, it's never more prevalent than it is right now in the heavy vehicle industry, with supply chain issues that are just critical. They're at critical point in many parts of our industry. And in that regard, you've got to really meet it head on. You've also got to, the industry and players have also got to embrace, test, push forward new safety technologies where we can. There's electronic recording of hours of work and rest, fatigue and distraction detection devices. Some of these are pretty new. Some of these are really coming into the fore and working and ironing out the bugs, but we must embrace some of these. We've had other ones around for a while, like lane assist and autonomous emergency braking. But we also have, to a large extent, a lot of our fleet is aging, where it doesn't have a lot of those technologies. So a lot of those elements, the broader industry needs to adopt to, not just regulation and how it's regulated, and that's coming from the NHVR, but the rest of the industry as well, because it's that collective approach which is going to improve driver health standard, not just just living up to a driver. But it's that collective approach that will help improve that overall, which helps them then, it's absolutely 100%. If drivers have better physical and mental health, they feel better about themselves, they feel better about the job they're doing, and helps them concentrate on doing the job in hand. And, one begets the other, but it won't be just a reliance on a regulatory change or about how that put in place. Got to be a collective effort.
Yeah, that's exactly what we said with the driving health study. We've said that it's a complex problem and it requires a complex solution.
Yes.
You need to break it down to levels sometimes to sort of be able to look at things, but you're not just going to fix one level and that's going to, impact the rest. Rod, I can see you're really keen to jump in. What would you like to say?
Three little things. One is, of course, the industry is so diverse. So there are tankers, then there's overnight express, then there's tippers, then there's refrigerated, then there's livestock. So we all want something different. That's hard. The level of scrutiny on us exceeds anybody else. Now, NHVR has come out and said that their on-road interaction will be about education first and then enforcement. We applaud that. We recognise it. As they take over the road authorities, we believe that's a step forward. But their control doesn't extend to the police. And the police are a problem for us because they're not trained with the HVNL, but they hit us over the head with it. I mean, I was going through Narrabri one afternoon and I had the radio off. I'd been talking on the phone. There's all these trucks parked up. Turn the radio back on. The local copper is up around the corner, just pulling trucks in at random, going through their logbook. And it's not that they've broken the law. It's that threat of he is going to go back. And again, individual officers, individual drivers. If the driver abuses him, he's going to get a ticket, right? But the copper can go back in your logbook, which is 100 pages. Now, that could be 3 months. You might be on the second last page of your book. He goes back 3 months to find one page you didn't tick or date or made a mess on. And that level of pressure is excruciating because you're not talking about a $10 fine or, right, just tick this box, mate, have a good day, away you go. It's, oh my God, here's a $600 fine. How the hell is my family going to pay the bills next week? What am I going to do? And that's why all these blokes were pulled up because he was there doing that. Now, I've written to every police commissioner in Australia and said, we applaud the NHVR's thing. What about you do that? Oh, we can't police half the law. Well, why not? Well, that's what the law is. And we've asked then and said, okay, well, if you're going to put a ticket out under HVNL, we want NHVR to review it, not some government association that's getting more money every time you get a ticket. Because that level of stress is when you're sitting here driving along, one, I've got the load. I've got $1 million worth of freight on the back. I'm responsible for it. Two, I'm dealing with these dickheads in cars that got their license out of a Weet-Bix packet and have never been taught to share the road. Three, I'm hanging on for grim death trying to keep the truck on the road because it's fallen apart and no one wants to fix it. Four, how do I comply with all these laws? And then you're never home. You're not accessible. That's a part of the job. That's what we do it for. But all of those things combined just put such a level of stress on you that when you drive, you virtually haven't got time to think about anything else because you're trying to manage all of that at once. And I honestly believe then you look, toilets. I don't know how far we're talking mental health here really, but how many of us just, oh, geez, I've got to go. There's nowhere here. Where do I go? And you've got to go off in the bushes and all that. You build that up into your body as well. Then you can't get good food and everything else, mate. So that there is a level there. How we address it is really hard, but I'm hoping that we can do something to improve that.
I think then, Rod, in the maybe a minute and a half that you were talking there, thinking of all the issues that drivers told us about in the driving health study, it was just ticking each one of them off, and I think you're right. People, the general public, don't understand that that's what a truck driver is dealing with, and I shouldn't be saying truck driver. A professional driver is the way that is the image that needs to be put across because you're dealing with all of those things at once. And that takes, a high level of skill, and that's something that is trained over time. What we did see in our study results is that the longer someone had been a driver, that the better their health was and the lower their psychological distress was, probably because they'd learned how to deal with it all and balance all of that. And I guess there's a real challenge. It's looming for the industry. We know there's a looming shortage of drivers. We know COVID has put a whole lot of stress on the industry that there's almost an opportunity now moving forward to, I guess, attract younger drivers to the profession. What do you think are the ways that we can use the information that we have? The approach that you mentioned in terms of an education approach, then enforcement. Where do you think are some of the opportunities to be attracting people to become a professional driver?
You're talking about the future of our job. I fear that some people are sitting back thinking, oh, we're going to have autonomous trucks next week. We won't need drivers. That's good. We won't worry about it. There are probably two things. And because the industry is so diverse, you've got a bloke that delivers bread every day in town at Cooperoo, and then you've got a bloke that runs to Darwin. There is such a gap. And the problem is the blokes in the industry who have done it for so long, if you look at the gross amount you earn for a year, people say, geez, that's good money. You look at the time and the hours you put in to do that, the lack of lifestyle, the lack of ability to get good food, sleeping in a truck 6 nights a week, people trying to kill you every second day in cars, and then you relate that to that money, you think, Jesus Christ, I'm not getting paid real well for this, for what I give up to do the job. So most truck drivers say to their kids, and years ago, that's where a lot of truck kids came from. They did a trip with dad. Gee, this is good fun. Let's go and do this. Now you can't do that for insurance. DCs, distribution centres, you're not allowed to take children. So how do you take them to work and get them encouraged? And then the truckie says to his son, mate, I've been through 3 marriages and I've never seen you for most of your birthdays. If you go anywhere near a truck, I'll kick you that hard you won't land for a fortnight. And yet if I say that, I get howled down. Well, how are we going to get people to come into the industry? Well, we have to fix the industry, because if we don't, you get these people who come in and say, oh, geez, good money, I can go and drive a truck. And look, there was a time a while ago, someone, I think at Monash or somewhere else, actually said we're getting drug addicts into the trucking industry because they hear about truckies taking drugs. So this will be good. Let's all go and do that. And we got all these people who are drug addicts. And they heard about the drugs because, again, the bad part of the industry gets all the press. It gets all the perception. But to go to school now and say to kids, here's a job, you come and do it, they're going to look at you and laugh at you, because they can be home every night. They can have a family. They can have a lifestyle. And it's really hard to change that. But to tell them it's good, and years ago it was, you're king of the road, you're your own boss out the highway. What a fantastic lifestyle it is. What a load of rot. It was never that good. But then we haven't solved any of the industry's problems. And those 3 I said to you before, rest areas, roads, and education of motorists. We haven't touched that. And then when people come into the industry, they're in there for a little while and they say, what's this, right? No one told me about this. I'm out of here. I can get that. So if we don't fix the problems, we won't get people in the industry. There is certainly a problem with a lack of training. Years ago, you got it because you went with your dad and you missed a gear change. He clipped you over the back of the head and you didn't do that again. And look, I've seen a video, maybe you have, there's a young bloke, 12, driving a road train on a private property. Now, he will learn and he will love that job. But to get others in, we have to fix the problems. And we're the most dangerous job in Australia. Everybody recognises that at the moment. We are losing blokes because of those penalties. I said to you, fines for something that have nothing whatsoever to do with road safety. And a bloke says, why should I do this when I can go and drive a forklift, go home every night, no one's trying to kill me or take me wages off me because I didn't tick a box?
Sorry, I just want to give Greg a chance. I've got a timer on my screen telling us how long we've got. I wanted to just throw to Greg. I guess from an NHVR perspective, what can we do to attract people to become a professional driver?
Rod's touched on some of the aspects there, Ross. We've got a chance soon about making regulations better and providing more flexibility. I think that whole work-life balance, it's with any workforce, but particularly in the heavy vehicle industry, rigid rules and rigid requirements often come out with a rigid result from a compliance enforcement perspective. The NHVR is trying to be a lot more flexible in its approaches, but again, we're quite open to say you can only do that so far. So that's that's one component of it there. I think I lament that the industry doesn't get together as a whole You know, you don't say, well, it's up to NHVR to do all the heavy lifting and tell how good it is, and that's so, or it's up to Rod Hannifey to do, you know, the whole lot. It's not. But the industry really doesn't help itself sometimes by not really coalescing together. And I think if there's anything about it, you know, the lesson that we learn is collectively, it is an enormously powerful industry. Harnessing that to put together the right messaging, the right flexibility for professional roles, and you know, to show that it doesn't need to be as stressful as it sometimes is. And you know, I think, and finally, getting into the minds of others on the roadway to share in a safe manner, really, really important. And that'll prevent a lot of heavy vehicle interactions, stress, and accidents as well. Thanks, Ross.
Well, thanks very much to you both. We're about to launch into, I haven't seen it, but hopefully there are some questions that have been rolling in. We might have an opportunity to answer some questions from people who've been listening. Thank you very much for sharing both your perspectives on, you know, it is a challenge for the industry, but you're right, we can't just keep saying it's challenging, it's tough.
Pleasure.
Thank you.
Fantastic. Thank you so much so far for sharing what you've shared today, Ross, Greg and Rod. Really invaluable discussion and information to highlight the impact of driving on individuals. So we've got a couple of questions that are coming through. So the first one is from Greg Casey. It says, it seems that drivers bear the brunt of legal action when breaches are detected. What is the proportion of legal actions taken against drivers as opposed to operators? And is there anything that can be done to balance this?
Do you want me to have a crack first, Rod, or do you want to hop in first?
Well, I'll give you two comments and then you can go on. One is, of course, that from the driver's point of view, we cop it all. We have sat back and watched Chain of Responsibility, a marvellous concept, but it hasn't worked up till now. NHVR are about to institute some proceedings, but you know, up until 12 months ago, as a driver, you'd sit back and say, well, where's all these companies up the road being taken to task? We're still copping it. So I'm hoping that the future is changing, but it's taken too long. And at the moment, we still cop, what, 95%, 97%, probably more.
I look at Rod's pretty on the mark there from a roadside perspective. So the roadside breaches, and if we look at like legal action, if you want to talk about that, where fines are issued when they are in breaches, they do happen at the roadside. We are trying valiantly to change that around, and when the new legislation came in, which really, to be truthful, it copied a lot of what the existing workplace health and safety legislation was in place for all operators around chain of responsibility and safety duties. Trying to target better where we can those players that are adversely impacting drivers and operators, either up or down the chain. You know, these are big players who are engaging, particularly with operators, to say, we want your driver to go from A to B, to do it in this sort of time slot at this time, do that, and you've got the contract. So trying to do that so that they're not adverse. Sometimes we get operators that are not operating in the best interests of the industry and the community. Sometimes that can be after incidents occur, or a string of them, or some other intelligence that you gather. You go in, you investigate a bit further and say, gosh, you know, they're not doing the right thing. Rod and I would call them cowboys. They are a very small proportion of the wider heavy vehicle industry. It's like saying that you know, all motorbike riders are gang members. They're not. It's only a very small proportion of them are. But unfortunately, they are out there, and you've got to try and target them. But it's not just operators, but it definitely is those third parties either side that in the parlance of Rod and I would use, that have never driven a truck or owned a truck before. It's often how they're requiring stuff to get done, or they're being involved in the industry in somehow. So getting them under the cosh a lot more is important. We're improving what we're doing, but it certainly hasn't been the greatest share to date.
Thank you both of you. So we've got another question coming through. I'm just aware of the time, so we want to get through as many as we can. The next one says, it seems that, whoops, hang on. No, done that one. Thank you to all the speakers for this excellent informative discussion. How are the policy frameworks recognising or responsive to the regulation concerns arising from truck drivers and the long-term psychological health impacts of the drivers?
Okay, well, I'll say up till now, they haven't recognised it at all. It has never been discussed. I remember driving through Gundawindi about 7 years ago when Monash or the St George Institute released a report saying that truck drivers were suffering under mental health. That was the first time I'd ever heard it. And here we are 10 years on now, starting to do something about it. There's a lot of effort going into it. The one concern I have is that there's now, much like earlier he said that the industry doesn't all get together. Well, now we've got a dozen different things underway to help us. And my concern is that not all of those will get to the bloke behind the wheel. That there's programs and there's things put out for those people, but will they actually get to them? And up till now, we've done a lousy job recognising it, let alone acting to improve it.
Yeah, that's so. Rod's close to the mark there as well. I think there are a lot more parties involved now, instead of the historical, few that were trying to improve policy perspectives and recognise those impacts on trucks. Like the Healthy Heads in their Trucks and Sheds is a significant organisation. They've got some good funding via NHVR and the Commonwealth and others to really progress some good stuff. Particularly, so things like looking at the quality of truck stops as an example. But again, it's trying to influence those larger players. I think more widely as well, the law is looking, whether it's enough or not, we can debate, but the law is looking at driver health more broadly in how to ensure operators have systems in place, but also, focusing on fitness of drivers. I think the key thing is, though, that there's other aspects such as Austroads, and they're assessing fitness to drive guidelines. So that's a bit more tools and requirements. And I just have to be really clear, this is not just about the driver. It's not just messaging and guidance to the driver.
Absolutely.
You really have to look a lot more closely at those other parties and other influences around. Now, whether that's operators and those third parties that deal with the operators, it is, as well as regulation and how we do compliance and enforcement as well. But those other components, the infrastructure, etc.
Wonderful. Thank you so much. I'm going to give each of you 20 seconds to answer this question, which has come through as well. So it's the final responses. How can we get drivers more involved in industry-wide solutions that will improve their health?
Geez, I said that we're all cynical, and they have every right to be. They've been stopped in truck stops. They've been asked to submit. They've been given supposed chances to offer consultation, and up till now, it's all been ignored.
Right.
I've got people to
so
go
listening.
to
Sorry to interrupt. Listening. Excellent. Listening and taking it on board. Fantastic. Greg, an idea from you?
Google NHVR, Google the Australian Trucking Association, get contacts, get onto them and talk to them about it. These are the people that can do some stuff about it, or try to get into their ears.
Wonderful. And Ross, from the research that's happened at Monash University, what has been some of the ideas of how we could look at involving drivers for solutions?
Well, I mean, I think we need to get more players involved. We've got to penetrate some of that cynicism, but it's, from what we found, it is absolutely a priority. It has to be done. If it doesn't, things are going to fall apart. So there's an urgency.
Fantastic. Right. Well, that's the end of the Q&A, and we're going to wrap up very shortly. So stay with us. We'll be back. And that brings us to the end of our first event of the 2022 Healthy Working Live Seminar. Today, we are hosting 6 free events this month, and we hope that you'll join us at some of the other ones as well, or all of the other ones. The next event is Thursday, the 10th of March from 11 a.m. till 12 noon AEDT. And that topic is how the job gets done. You've got to do what you've got to do. So the panel will discuss what it's like to be a truck driver in Australia, leading on from the information delivered and given to us today, and how they manage to do what they need to do, and how they're expected to get the job done regardless of the pay they receive or the hours they work. So I'd just like to say that this panel discussion is featuring Associate Professor Ross Iles again from Monash University, along with special guests Naomi Fronfielder from Healthy Heads and Trucks and Sheds, and Rod mentioned Healthy Heads and Trucks and Sheds and other types of programs that are beginning to roll out across Australia as well. And we also will be joined by Associate Professor Sharon Newnham from Monash University Accident Research Centre. So I'd like to thank the speakers today, the panel discussion and the presenters. It is fantastic to have you here and contributing to this vital, important topic going forward. And we know that this is not the end of the discussions. We know this is the beginning of raising things, and we hope that you will join us for more information, for developing and identifying this discussion even further by logging into drivinghealth.net, where you'll find a whole lot of information and contact details as well. So hope to see you on Thursday, and thank you so much for being here today.